Are you curious about Gestalt language processing? You are not alone. Join me, Corinne Smoose, and speech therapy PD for our podcast, The Gestalt Get Together. Our episodes try to balance the enthusiasm and excitement about GLP and its associated intervention ideas, as well as a healthy dose of skepticism about how to understand and integrate this paradigm shift into your career and the field at large. We hope that you can get together with us to learn more about Gestalts.
Welcome to SLP Learning Series, a podcast series presented by SpeechTherapyPD.com. The SLP Learning Series explores various topics of speech-language pathology. Each season dives deeper into a topic with a different host and guests who are leaders in the field. Some topics include stuttering, AAC, sports concussion, teletherapy, ethics, and more. Each episode has an accompanying audio course on SpeechTherapyPD.com and is available for 0.1 ASHA CEUs. Now, come along with us as we look closer into the many topics of speech-language pathology. Okay, welcome Dr. McFarland and Dr. Wiley.
Hello, and welcome to Ethics is Essential. I'm Dr. Elise Davis McFarland, your host, and today we're going to be talking about ethics in private practice. An entrepreneurial spirit leads some speech-language pathologists to develop private practices where they can be their own boss, specialize in certain types of practice, and perhaps even employ a staff to support and further their business. The number of speech-language pathologists who own private practices continues to grow. Over 30,000 of ASHA's members have a private practice. Successful practices require everything from a sound business plan to strong management skills, successful marketing to attract clients, and strong personnel management skills if there is a staff other than the practice owner. An important aspect of successful private practice is maintaining a strong ethics core for the practice. The practice owner has to be careful not only that they are ethical in all of their business dealings, but also that their employees adhere to ASHA's Code of Ethics. Failure to do so can result in the practice losing the respect of the residents of the community in which it resides and loss of clients, employees, and the owner's livelihood. In a private practice, ethics is as important as meeting the weekly payroll. So let me introduce you to Dr. Pamela Wiley, who is our guest for this Ethics in Private Practice podcast. Dr. Wiley is a speech-language pathologist and a fellow of the American Speech-Language and Hearing Association. She is the founder of the Los Angeles Speech and Language Therapy Center in California, and the Wiley Center for Speech and Language Development, which is now celebrating its 40th year of service. Dr. Wiley has written several professional articles and co-authored 4 social skills therapy workbooks for children and adults with autism spectrum disorder, and she is a frequent ASHA presenter. A recognized expert in providing innovative services to young adults with autism spectrum disorder, she enjoys traveling and sharing her knowledge and expertise with professionals and parents worldwide. Dr. Wiley, welcome to All Things Ethics. You've had a long career as a speech-language pathologist and as a highly successful private practice owner. I'm sure our listeners are very interested in hearing about your career, and in particular, your ideas about ethics and ethical practice requirements and challenges in private practice. You're celebrating 40 years of private practice and private practice ownership. How do your ethical principles shape and influence your business?
Our ethical principles basically are the foundation for everything that I do. Morality influences my code of conduct, the values, decision making. Excellence is always the standard, but I think at the end of the day, it's how you've achieved the excellence. And so your ethical principles allow you to achieve excellence in a very transparent manner. So there's nothing hidden that one could find out about me and what we're doing because I'm always consistent with what ethical principles are and what our ASHA code of conduct talks about.
Well, that certainly makes a lot of sense. Let me ask you one other question. How would you define your ethical leadership?
I'm pretty much perceived to be a straight shooter. Everybody knows me to be very honest. I have integrity, strong principles. I'm also very fair. I believe that I lead by example, so I am very fortunate to have amazing staff people that have been with me for many, 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 many years, one almost 40 years. And it's because I lead by example. And so I can't ask you to give me your best if I'm not willing to give you my best. I can't ask you to care about our families if I don't care about them and if I don't care about you. So I think my ethical leadership style transfers to all levels of the business, which is what's made me successful.
Well, and as you say, you've had 40 years of experience in the development of your business and as well as in the practice of the profession of speech language pathology. So let me ask you something else. You mentioned that your code of ethics influences your hiring practices and your staff training. Share with us what aspects of ASHA's code of ethics you consider as you're hiring new clinicians or taking on clinical fellows or providing staff training on evidence practice and other aspects of bringing in new employees and providing training and direction to keep your staff on the cutting edge of practice.
One of the things that ASHA talks about is our responsibility to the individuals that we serve. So one of the things that we do in interviewing our people is asking basically, what has been your experience? And not just allowing them to tell us the experience, but we really go in depth. We want to find out how the outcomes were, what were challenges that you faced, how you overcame them, what your interests are, and also how do you stay on top of all of the changes in our profession because it's really important to be willing to grow beyond where we are today. And that's what I think is so beautiful about our profession is that it's always changing. You're always learning. You can never sit back and feel like I know it all. So we want to know how you feel like you, or what are your thoughts on how to take care of yourself to continue to help you grow. When we do our interview, my part of the interview is to look at your character. And so I ask questions that reflect ethical dilemmas that I've experienced over the last 40 years. And it's really interesting to see how people respond to this particular question that I ask. And I won't say what it is because it gives it away. But I've seen distinct patterns of behaviors and responses. So men respond one way, and this has been consistent through the years. Men will respond one way to this question. Women will respond a little differently, and African American women will respond even more differently. But again, what I want to find out is what's your character like? How do you respond to some of these situations? Because we're all coming in with the same basic foundation of knowledge. So you have your master's degree, you have a handle on XYZ. But in terms of who you are, your character, your integrity, that's the part that I want to know about. Because as I tell people, we value what we do. I think how you start out is important. So we want to make sure that it's not just a good fit for me, but also one for you. And so our interviews are so in depth that 9 times out of 10, people say to me, I've never had an interview like this before. And even then, we don't hire on the spot. I tell people, walk away and think about it. Let's talk next week. And that way, when you get the people that you get, you're getting people that have the qualifications, that have the character and integrity to be a good fit to maintain what we have going here. Another piece I want to mention is the knowledge of cultural diversity and cultural awareness. That's also very, very important because here in LA, we have a very culturally diverse clientele. And so we have a very culturally diverse staff also. So I love to say that we reflect the people in LA, which is a diverse group of people.
Thank you for that, because I think it really helps our listeners think about some additional things that they might want to consider in terms of hiring new employees. I thought that your comments about the different ways in which the different groups of people answer questions is very interesting and very revealing. Let me ask you about the training that you do for your staff and ask you, what is it that how do you incorporate the code of ethics into the training that you do for your staff? And what is it that you emphasize in terms of ethical practice and the code of ethics?
Basically, I think what we do is from the time they come in, we're always sharing with them ASHA's code of ethics, what's expected of your CF, what's expected of us as your CF mentor. So everyone is very aware of that, and we have put documents together, even in terms of how we evaluate your performance, but how you get to evaluate us as well, based on a lot of what ASHA recommends. So one of the things that we talk about basically is just, again, the importance of staying on top of what's going on. So all of our staff are encouraged to go to ASHA. So you're given paid time off, and we'll pay for the hotel because I want to make sure that you're learning, because the more you learn, the more capable you are to be effective with our families. So we do a lot of that. We do cultural sensitivity training. Sometimes it's one-on-one. I've noticed certain staff that may come and you can see that they're uncomfortable with certain families. So that's a person that I will personally work with. Other times we'll do things like have a potluck. And so maybe our Latino staff may bring in something to reflect their culture, and they will take the lead and talk about how parents perceive their role, or just family dynamics, all the things that are important in order to be able to work effectively with these families. So we'll always take a turn at talking about our culture. And again, what we've done, because we do have such diversity, is learn from each other. And that's helpful for all of us because, you know your culture, and we may know some others, but we don't know it all. And to actually have what we call an in-house expert on this different cultural group is really, really helpful. And so we continue to grow and continue to look for diversity here in our practice.
I think you're mentioning learning from each other is really very, very important, and something that we may not always think, especially in our profession. We spend a lot of time in workshops and in continuing education opportunities and learning and reading and listening, but in very formal situations. But the idea of learning from each other, those of us who are right there in the workplace, and also, I'm sure, learning from the families that you work with, obviously great learning opportunities and opportunities that are to be encouraged and to be valued. So I think that's interesting. I've had an opportunity to meet some of your staff members at ASHA conventions, and I do know that you have a very diverse staff. And I'm sure there are a lot of opportunities for learning among the staff members themselves, which is great.
Absolutely.
Yeah.
And we can all learn, and so for me to have one group of individuals only in the workplace, for me personally, would be boring. And so to be able to have such a diverse staff it's very, I guess, it excites me, again, to just get to know the different cultural groups, to know some of the values, to know just to learn the language, to learn about the people. So it really does open our eyes and makes you much more accepting of others, because we know in the absence of any meaningful contact, you rely on stereotypes. So we don't have to rely on stereotypes. We actually have living, breathing individuals that can be a reflection of a cultural group.
I think that's great. Having in-house cultural ambassadors is is
I like that.
quite a great educational opportunity. When you were speaking earlier, you said that when you interview your prospective employees, one of the things that you do is share ethical dilemmas that you've experienced over the last 40 years. I'm going to come back to that and ask you to share one or two of those with us and tell us about what decisions you made and how you overcame those dilemmas. But let me go on to something else right now. And your center provides programs for clients who are 18 months through adulthood. You've had clients who are now adults who've been treated in your practice since they were children. In fact, there was an article in the ASHA Leader, I think a year or two ago, about your pre-employment programs for young men who are on the autism spectrum. How do your professional and personal ethics influence your interaction with clients and their families so that you have the opportunity to serve families over such a long period of time?
I think that what we do, and this is based on what parents continue to tell us, is that our environment is very warm, very positive, very affirming. We respect all families. We realize the role we play versus the major role that they play. So I may see your child for 1 hour once a week, but you see him for the rest of the time. So we depend on families to also give us direction. We encourage them, we empower them, and as a result, the families just really believe in us. And so they don't leave. And I think they also know that I don't put a price tag on a child. And I know that that's counterproductive or counterintuitive to business people. But for me, the kids are more than just my clients. And I really want the best with them, which means I can't get paid for every little thing that I do. And so our staff will also come to bat for families. So, for example, you may be referred by a particular agency. The agency says they're no longer going to pay for whatever reason. What do we do with this family? And that's a no-brainer. If it's someone that's been consistent, someone, and we've made progress with that child, I don't want to see the progress lost while they're fighting about who's going to pay for service. So we have carried people for a year without thinking about getting paid, but always get paid, because in the end, when it's settled, that same parent goes to bat and says, now I want you to pay for the therapy that this person provided for a full year. And so we always come out on the winning end, but the focal point is always the kids. My other concern is that for families that can afford more, their kids are going to be fine. So my concern is always for those individuals who are from low-income families, families that may not have the best schools, kids that have the greatest needs. And so for that's our focus. And so we don't put a price tag. We will continue to fight and continue to work. Parents know that, and as a result, they're very, very, very loyal.
So you as a private practice owner and employer are making a distinction between a business decision, which is I need to be paid for the services I'm providing, versus an ethical decision. Am I going to let this child go because they can't pay when the family has been consistent and this child is making progress? Which is very interesting. Can you talk a little bit about how you get your practice to the point that you're able to make those kinds of decisions and those kinds of distinctions?
I don't know about how I get them to the point, but that's kind of always been what I've done. I just always believe we're going to be fine, and we're always fine. So I just don't put a price tag on everything. And we've always been fine. I don't know if that makes sense. Ask me another way. Maybe I can give you a better answer.
Well, no, it does. It does. I think what I hear you saying is that That's just part of your own personal belief system, part of your DNA and the way you treat people. And that being true to your own ideas about how the practice should work and how you treat people is what informs the decisions that you make. And I thought it was interesting that you said that in the end, it always turns out okay. And that there are even instances in which, after you've gone to bat for the child and provided, or the family, and provided services without compensation, then the family goes to bat for you
Hmm.
in whatever way that they
Hmm.
can.
Yeah,
And so,
that's absolutely correct. And I think the other thing is, because we've had these long-term relationships with these families, you see the great potential in these kids with autism. And so we talk about beyond the label. And so these kids are moving beyond the label of autism. And so for me to close the door on someone for money, I just can't. I can't do it. And my staff feel the exact same way. And so it's so interesting when I see them go to bat for somebody. I go to bat, but they also will come and plead a case for someone. And so families know that we're going to take care of them. And as I said, in the end, they take care of us. Some of them that we've not charged for services will say, for example, I had a parent for at least 5 years that made beautiful floral arrangements for me. And all I did was one summer, she could not afford to come to our summer camp program. And again, my thing is, if you have 10 kids in a group that are paying, you can have 12. You can have two that are unpaid. We're okay. So this mother continued to give me flowers, the most extraordinary arrangements ever. And then when years later, I'm like, please let me pay you. And she's like, you can never give me enough money for all that you've done for my child. As long as I'm able to do for you, I will continue to do for you. So it all comes back, but I think it's just a real commitment to what we do, and then the compassion piece, because everybody can't write that check. So do I not help those people because they can't pay? No, I'm here to provide a service, and that's what's most important for me. So as long as I feel like I can make a difference, then that's what I'm charged to do.
I can imagine that some of our listeners may be contemplating developing a private practice, or may just have a newly developed private practice. And they may be thinking, well, she's been in business for 40 years and she's very well established. And so I can understand how she can make a decision not to have a child or a client to not pay. But what about me? I have obligations. I have bills that have to be paid. And so I'm not sure I can do this. But I think what I hear you saying is that the relationship is the currency. And that if you provide good services and you do it ethically and with the benefit of the child and the family in mind, that there are ways to work out those situations, that in practicing and as well as you can and being ethical, you attract others who can make up the difference for those who may not be able to come up with everything that's needed at all times in terms of the financial support. So I think
Absolutely.
that's an important point that you're making in terms of the relationship between ethics and business decisions.
And you know what else? You can also change the mindset of a lot of people. So, for example, several summers ago, the state said we're no longer paying for summer camp services for kids. So, my immediate thought was, well, for my families that can afford to pay for childcare, competent childcare, they're in good shape. But what about people that were depending on summer camp and now have nothing for their kid to do? So, I said that I would continue with my summer camp and actually got the media involved. And when the media came out and interviewed me, bottom line, at the end of the day, the state paid for summer camp. And it was just because I was the only one. Everybody else said, well, either we'll charge the parents or else we won't do it. And I thought, I don't have enough families to charge. I don't even want to get into that. I had planned summer camp. I'm going to provide summer camp. When the media came and said, tell us what's going on, and I pleaded the case for the families that would not have any options, state changed their decision. So they paid for summer camp. So the point is, sometimes by being committed to the cause, committed to doing the right thing for the right reasons, again, you can get the right results. So I was paid for summer camp, just like everybody else was. But had I not have put my foot down, families would have lost out. Families that couldn't afford to pay for a service would not have had anything for their child for the summer.
That's a great lesson for us all. Let me ask you about this. You have strong relationships with corporations and large businesses that step in and support some of your programs. An example is that was cited in the ASHA Leader article that I referenced earlier. One program that you have is a safety with law enforcement program, in which you train your adult clients with autism on how to react to traffic stops and other encounters with law enforcement. Because of corporate support, these training sessions are free to families. How do your ethical standards influence your interaction with corporate America?
I think that people trust me. I have a reputation for being someone that is ethical. And so the word is out, and usually one corporate partner will tell another corporate partner. The word is out, and so people trust what I do. I also have been told by various individuals that they connect with my passion. They feel the passion, they feel the energy, and they want to be a part of it. And the third thing is that, as my mother used to always say, the proof is in the pudding. So I can always stand back and talk about what I do, or I can showcase my kids, and they're like the secret weapon. And when people meet my kids that are now 21, 22 years old with autism, who will say, I started when I was 4, I don't remember, but I started here a long time. People are impressed with that. And so corporate America will gladly support us. They support any number of our programs. And I talk about the fact that while we get paid to provide the services, the extra support that I get allows me to take things above and beyond. So instead of getting basic service, you're getting premier services because we've got the support of corporate America.
Very, very interesting. You also have a pre-employment training program that I understand has been very successful, for which you've also gotten really, really good support. Let me go back to something that you said earlier, and that is that when you're interviewing prospective employees, you will pose or you will share with them ethical dilemmas that you've experienced over the last many years of your practice and your work. Would you mind sharing one or two of those with us and telling us, what the dilemma was and how you were able to resolve it?
Well, the one that comes to mind is we had a disgruntled employee who one day made the statement in the lunchroom in front of some other staff, one of my newest staff members, that she was going to be leaving on Friday. And she wasn't going to tell us, she was just going to go. So the young CF heard it and came into my office just frazzled. And I couldn't figure out what was going on. And then she said, I hate to tell you, I don't want to tell on people, but I feel like you need to know this. On Friday, so and so is planning to go, and she's not going to give you any notice. And I'm concerned because she has big caseload of clients. What are we going to do? I'm concerned. So she said everything that was appropriate. She was concerned about the families. She realized families would be unserved. She also knew that the responsibility would fall on everybody else, or we would not be able to provide a service. So she told me, and she said, I feel terrible, but I felt like you needed to know. And I really, really appreciated that, because what that gave us time to do was to plan. We were able to identify who would go where, who was going to do what. So when this person left us on Friday, we were intact. And so that's one of the questions that I ask. How do you handle that information? What would you do? And you see people squirm saying, I don't know. Or others will say, as I said, I see the difference. The men say, I would come and tell you. Women typically are a little more uncomfortable. And then sometimes my women of color will say, if they weren't talking to me, I wouldn't say anything. And I always tell them there's no right or wrong answer. And there really isn't. It just depends on, who you are and what you're comfortable doing. But those are the kinds of things that have occurred, that it's because of people telling me what's going on that I've been able to get ahead of it.
Well, that's interesting because you had a potential situation of client abandonment there, which is most definitely contraindicated by the ASHA's Code of Ethics. And also the issue that in terms of the employee coming to you and disclosing that information. And obviously that's certainly what we would want someone to do, but it's not something that an employee might necessarily feel comfortable doing. And so I think one of the things that's important in terms of our understanding about the code of ethics is not only what it is that we should not do, which is very often what we see in the code, but there's some things that are not necessarily stated in the code that we do need to do. It seems to me that in that situation, in terms of preparation, what the employee did in coming to you was really in the best interest of the client, because it did give you an opportunity to plan and not leave that client without the services that he or she was coming to you for. And so I think you raise an important point there. And that is that sometimes the ethical thing to do is something that may not even be mentioned in the code, but that goes to the essence of the code, which is we have to put clients first, whether they're our clients, our students or patients or colleagues. We have to be concerned and do what is required there. So, great example. You recently wrote a very nice blog entitled 7 Lessons for Newly Minted Speech Language Pathologists, in which you cited 7 lessons that you've learned over your career that you said, and I quote, feed your spirit and nourish your soul, end quote. One of your lessons is to keep plenty of mirrors around. Look closely at whether the person you see is the person you really want to be. And when you doubt, you tell them to, quote, refer to our ASHA Code of Ethics, end quote. Talk to us a little bit about what your thinking was there in terms of that particular lesson for new speech language pathologists.
I think at the time, I actually wrote this in 2014. And I think at the time I was thinking about a lot of the young people wanting to go into private practice for money. And that would kind of be the discussion when they would say, I want to make money. And so I talked to them about, money's not the be all end all. And then what you see though are people who have gone after the money and then made many mistakes, because again, you're going after the money. And so I talked about when you're feeling something, because you know right from wrong. So for example, oftentimes you'll have parents that will say, listen, I didn't come, it's okay, just go ahead and bill. And one person that I think of that probably I was thinking at the time I wrote it did it. And then when the parent became disgruntled with him, the parent said, they falsified documents. I didn't come all those times. So now their whole business was affected because of the fact that, they lied. They lost the contract, lost credibility in the community. So at any rate, my thing is, look at yourself. And when you're in doubt, when you're thinking about something, you know that you should not say, I provide the service if I didn't do it. But maybe you're tempted. So there's a doubt. So then look at your ASHA Code of Ethics, and that will tell you not to do that. So our Code of Ethics is very comprehensive. You know, when you look at it, it covers everything, and that it doesn't cover pretty much fits in there anyway. So basically just saying, look at our Code of Ethics and use that to help guide your decisions when in doubt.
As a person who's had an awful lot of experience in developing practices, in supervising employees, hiring, all aspects of private practice, can you speak about perhaps 3 ethical violations that private practice speech language pathologists might be more likely to make or should be very careful not to make?
I think one that comes to mind is, and it's clearly an ethical violation, but not being forthcoming or transparent in reference to who is providing the service. So now that we have SLPs, oftentimes agencies are using SLPs, and they are billing for a licensed speech pathologist when it's really a SLPA. The parents,
And those are
those are
assistants.
assistants, speech language
Uh-huh.
pathology assistants. The parents oftentimes are not told that it's a speech language pathology assistant. And it oftentimes comes out when they will maybe complain that this person didn't know X, Y, Z. They complain to someone that says, well, wait a minute, licensed speech pathologists should know that. As they dig deeper, they find out that it's a slip-up. Or you also will have college interns. And again, they're not fully disclosing that to the families. So being transparent is really, really important. So that's a problem. That's an ethical violation. Another one that I think about is the record keeping. What I see is a lot of newer SLPs really aren't into keeping records. And you have to keep records. We're audited, agencies are audited. And so if you can't prove, you have no record that you really provided the service, agencies will come back and have you pay. You will have to reimburse them because you don't have proper documentation. The other one that I mentioned is that you really should only bill for the services rendered and not allow parents or anybody else to convince you to bill, because that's a big no-no. And invariably, if something changes in the relationship, that person now can basically tell that you falsified the documents. And whether the parent told you to or not is not the point. You are not supposed to do that. The third one that comes to mind is reporting colleagues who are unable to provide professional services. So every now and then you get individuals, and we've had it, one in particular, that I felt was mentally unfit. And they had been a traveling therapist. And while I was going to sever ties with them, I was very concerned, because if you're a traveling therapist, you really don't have anyone that's supervising you. And so I knew this person was mentally unfit. So I think that we've got to be willing to contact ASHA in situations like that for whatever reason. If someone's mentally unfit and they're working, I think it's our responsibility to let ASHA know
And
let them take it from there.
And having served on ASHA's ethics committee, some of the points that you're making are certainly things that I know do come before the committee. They certainly did when I was there. And documentation, as you said, is very important. And it's sometimes, especially if you have a heavy caseload, you can get behind in terms of documentation. But that's something that you cannot let happen. You've got to keep it caught up, and it has to be accurate. Very, very important. I've seen people reported to ASHA's ethics committee because of documentation lapses, not doing the documentation, not having the documentation that's necessary. And so that's an excellent point. You made some other really good points too, but I want to ask you also about the ethics of something that I refer to as the ethics of competence, which actually was the title of an article written by William Mustaine that was in the ASHA Leader some years ago. But he talks about the importance of learning new things, new techniques, new ways of doing things, of being up on what is evidence based in terms of the techniques and things that we use in terms of remediation. But he goes on to say that we also have to be able to evaluate the outcome of what we do. And so I wanted to spend just a few minutes talking about the ethics of competence and asking you how it is that you are able to monitor your employees to determine whether or not they are always providing evidence-based intervention and whether or not they are in fact continuing to be competent in terms of the services that they provide.
In our clinic, we have cameras in every therapy room. And so your light is to be on, which means the camera is running at all times. Periodically, I will work in one of our larger conference rooms where I can just kind of stretch out. But I have a TV, and I will have the TV going, and I'm looking at various therapy sessions. And it's a good opportunity for me to sometimes see what's going on. And if it's one of our CFs, then I will share that with the CF supervisor. Or if it's one of our licensed therapists, just kind of get with them at lunch and just say, you seem to be struggling with so and so, happen to be looking at your session. Let's talk about it. So that's how I handle it. But we also, for our CFs, follow what ASHA has put in place almost explicitly, and then we've added some things to it. So that's shared with all of our staff, all of the CFs when we first hire them. Here's what we're going to be using to evaluate you. And then we're watching them all the time, as I said. And it gives me an opportunity to also see what's going on.
So, the very first ethics principle is that individuals shall provide all clinical services and scientific activities competently. And so you've described to us a very nice way of ensuring that your employees are, in fact, providing services competently. But what you're also saying is that in terms of your supervision and your ownership of the practice, you've made an investment in terms of being able to a monetary investment with the cameras and the monitors to be able to ensure that your clinicians are in fact providing services competently. So I think that brings up a very good point in terms of private practice and the responsibility that the owner has and the investment that the owner has to make in order to ensure that the services that are coming out of their practice are being done competently. So I think
it's your reputation, and I think that we need to keep that in mind because your therapist can come and go. But at the end of the day, unless you intend to pack up and go, you want to be there. And so making sure that everybody is providing good services, keeping in touch with families. I know all the time what's going on, what our families are feeling because I'm out and about, and I know them. And they will bring in friends, they will tell other referral sources. So a whole lot rides on making sure that you're providing good services and also treating all of the families with respect and dignity. Whether a mother has a high school education or a PhD, she loves her child just as much as the other. And so I think sometimes we tend to discount the engagement of some of our families or the values of our families. So it's just important to realize that we're here to serve all, regardless of race, income, zip code. Every client that we take on is a valuable client.
And that certainly, that attitude, though, that thought certainly is in keeping with the code of ethics. And I think, the code of ethics is inspirational as well as aspirational. I think reading the code can really inspire you in terms of the profession and in terms of what our responsibilities are to our clients and to the profession. But it's also aspirational. I mean, we do aspire to be ethical clinicians. But I think that what you're saying in terms of how you view families, how you view your clients, your patients, your students, and the families is really important in terms of informing how it is that we relate to the code of ethics. Because I think if we have the types of attitudes and ideas and thoughts about families and clients that you're saying or that you are communicating, it does make ethical practice. It just fits in so well with the ethical practice of our profession.
Hmm. I think we've got a great profession. Communication is so very, very important. And I think that we have to conduct ourselves in such a manner to say, we're important. We really will make a difference. So it's just about asserting yourself and then providing. So you can talk what you want to talk, but at the end of the day, deliver.
Important, very important. Let's talk for just a moment about confidentiality, because that is one of the things that we see prominently in the code of ethics, and that is protecting confidentiality of professional as well as personal information. What about that in a practice in which you employ several people, several who are clinicians, you have other people who are supporting them in terms of administrative duties, and even other people within the environment? A lot of what we as speech language pathologists hear and see and know about people is highly personal. What about confidentiality, and how do you ensure that in a practice, especially a large practice like you have?
We make all of our staff aware of the confidentiality, the importance of it, the HIPAA regulations, to the extent that even sometimes young therapists will want to casually walk into the waiting room and discuss with the family what took place with their child. And we don't allow that. That's you're violating their confidence. And I'll sometimes use the example, you go to your doctor, does the doctor walk you into the waiting room and tell you the results that of the work? No, he doesn't. So you want to treat them the same way you'd want your doctor to treat you. So no matter how comfortable you are with the family, it must be done in the office with your door closed. We also have parents that sign in. The signings that they do are all done in the office. So you can sign initially just saying that you've entered the building. But when they go in with the therapist, then that's where you will even conduct any kind of business. Anything has to be done in the office. We also have something, I think it's our HIPAA regulations that say files have to be in a locked file behind a locked door. So we have locks on our doors and you have a lock on your file cabinet. So, and you can't take records home. You have to do them here. So we really work hard from the very beginning to make sure that everybody understands the importance of confidentiality.
I had an experience that was really interesting. I was in China not long ago, and as part of the work that we were doing there, we went to a children's clinic where children, what they refer to as high risk children, and those are children that are born with low birth weight or have some indication that they may not be able to develop as typically developing children do. They go to this clinic, and parents bring their children to this clinic 2 times a week, every week between birth or when it is determined that they are high risk through the age of 12 months. And at that point, they are reevaluated. But we got to see these babies, these infants. Some were receiving sensory integration work, others were receiving massage. There were children who were in water, being put in water and were with a neck ring and were floating in order to increase their sensory integration. And we just saw a lot of intervention with very young children. And it was interesting. We were in a group, and one of the members of our group pulled out his cell phone and started filming, uh, doing a video of one of the children who was being worked with. And so I said to him, "Are we allowed to do that? You know, in America, you certainly wouldn't do that." And so he asked the nurse who was working with the child, and she said, "Oh, yes, it's fine." And it really made me think about HIPAA and the difference, the cultural differences and differences, I guess, from country to country in terms of confidentiality and how we handle information and what we share and whom we share it with. But
Hmm.
I thought that was something that really made me think about the difference between
Hmm.
there
Hmm.
and what is required of us
Hmm.
here
Hmm.
in America.
And
Le-
Dr. McCollum, I was going to say, with cell phones and social media, when we do our summer program, we have a lot of college students, a lot of high school interns that will come, and they love the kids. And you look, and they've taken all these pictures, and I have to tell them, I learned them. You tell them up front, you can't take pictures of these kids. You cannot post it. We
Mhm.
cannot do that. And they initially were stunned because I just think he's so cute, and I just was showing. I know, but you can't. And so that's really important to talk about that at all levels. Anybody that's touching these kids needs to realize that confidentiality is important. Can't share information like that.
Yeah. Yes, yes, yes. And I really thought about that a lot while I was there because there things were a lot more open and a lot more shareable than they are here, which is very interesting. Another one of the principles in the Code of Ethics is that individuals cannot knowingly allow anyone under their supervision to engage any practice that violates the code. And I thought about this in terms of practice ownership, because I guess as a practice owner, you ultimately are responsible for anyone who works within your practice. And so an ethical violation on the part of an employee could, in fact, come back with the private practice owner being seen as also being responsible for the lack of ethics or ethical practice.
Hmm. You're absolutely right. And I think as the private practice owner, you just have to realize that the buck stops with you. And so the excuse that someone that works with you, for you, did something is not an excuse. So you really have to be very hands on. I'm visibly present and always a phone call away, but I'm a hands on person because, again, I know how things can happen. You learn from other people's experiences and you're thinking, wow, this didn't have to happen if they had done XYZ. So as I have learned of various experiences, then I consciously make a decision of how I'm going to respond in that situation. So there are a lot of provisions in place to make sure that everyone is doing what they're supposed to do. And at the end of the day, something still could happen. But it's not because I have not tried to think of every possible outcome and how to prevent certain things from happening with us.
Well, that certainly makes a lot of sense. And again, I guess for those of us or those of our listeners who may be contemplating developing a private practice, especially if they're going to employ others, I think that one of the things that our conversation has indicated is that there really are an awful lot of things that have to be considered, a lot of things that have to be thought about, a lot of I's that have to be dotted and T's that have to be crossed in order to have a successful practice. And it's above and beyond the owner's clinical competence and knowledge of the profession and intervention techniques and on and on. But you really do have to be able to anticipate some of the issues that can arise and do everything that you can to make sure that they don't, or that if they do, you're prepared to do what's necessary. So let me say, Dr. Wiley, you have certainly given us a lot to think about. And I really appreciate your sharing your ideas about ethics and ethical practice in private practice ownership, as well as clinical services. So thank you very, very much for joining us.
Thank you. I appreciate the opportunity to share.
Thank you for joining us for today's course. To complete the course, you must log into your account and complete the quiz and the survey. If you have indicated that you are part of the ASHA registry and entered both your ASHA number and a complete mailing address in your account profile prior to course completion, we will submit earned CEUs to ASHA. Please allow 1 to 2 months from the completion date for your CEUs to reflect on your ASHA transcript. Please note that if this information is missing, we cannot submit to ASHA on your behalf. Thanks again for joining us. We hope to see you next time. Each episode comes with an accompanying audio course on speechtherapypd.com, available for a 0.1 ASHA CEU. And just for our listeners, get $20 off any subscription with promo code SLPLearn20. Speechtherapypd.com is run by SLPs for SLPs. They've got the largest library of ASHA CE eligible courses out there, and they're adding fresh content every week. Remember, use the code SLPLearn20 to get $20 off access to over 1,000 courses for an entire year. Head over to speechtherapypd.com for more information and start earning CEs today. Thanks for tuning in to the SLP Learning Series. And don't forget, speechtherapypd.com is your go-to for all things ASHA CEUs. Your positive reviews and support mean the world to us, and we'd love for you to drop us a quick review and hit that subscribe button.